A swing bed is a service that rural hospitals and critical access hospitals with a Medicare provider agreement provide that allows a patient to transition from acute care to skilled nursing facility care without leaving the hospital. In recent years, swing beds have become increasingly important in the financial health of rural hospitals, as they not only supplement reimbursement but also produce more efficiencies in controlling cost. At the Georgia State Office of Rural Health, funding for swing beds is managed by the Hospital Services Department, with Dawn Waldrop serving as the director, alongside Amanda Sutton as Program Operations Specialist. Recognizing the importance of swing beds, Hospital Services has pled the case for continuing the Rural Swing Bed Management Training Program to ensure both critical access hospitals and prospective payment system hospitals have the knowledge and resources needed to effectively manage their swing bed programs. As a result, the Department of Community Health recognizes the value of this program and has continued to support programming with $200,000 in state funding annually since 2016. This annual funding is directed to and managed by Hometown Health, LLC, a network of rural hospitals, business partners, and healthcare providers. To help carry out its vision of supporting rural healthcare, Hometown Health subcontracted Carrie Dunning as its organization's subject matter expert on swing beds. Carrie Dunning is the founder of Carrie Dunning, LLC, a company that specializes in post-acute consulting services. Swing beds play a major role in the current climate of healthcare, and Dunning highlights the growing importance of swing beds.
One of the values of the swing bed, even though it's a skilled nursing level of care, is the fact it is hospital-based. So when you have COVID patients, for instance, we had the ability to have a lab on place. We had respiratory therapy services. We had nurses that were trained in acute and ICU level. So it's a very good practice for all of that.
Dunning went on to explain the significance of swing beds both through the lens of the COVID-19 pandemic, as well as in times before and beyond.
Swing beds are a major part of what we work on now, and a lot of it is because of the growing need for swing beds in rural health. And I think the pandemic year actually highlighted the value of swing beds, because when hospitals, both urban and rural, did not have beds, acute and ICU beds available, and nursing homes were unable to take admissions at that point because of COVID, the swing beds across the country filled up and were able to take very, very seriously ill patients and care for them. More importantly, I think in a non-pandemic year, one of the reasons we're seeing growth in swing beds right now is really simply because we are an aging population. We have more Medicare age people hitting healthcare. We have more chronically ill patients, and we're living longer. So with all the illnesses that they can come in with, it is not a simple, let's do these 3 meds and these 3 things and we're going to send them home. It takes a team of specialists. And again, the value of a swing bed is it is hospital-based.